Welcome dear students. I hope you must have liked all the MCQs of CBT2. Let us discuss very standard, very simple, straightforward MCQs on current all India pattern. So let us discuss all these questions one by one. The first MCQ which I have given in your CBT, this wave 3. Wave 3 in the given image. First of all, let us investigate or let us confirm the investigation. We are showing you BARA, ABR is the investigation of choice. Always remember, is the investigation of choice for neural deafness. For neural deafness, that is retrocochlear deafness. Retrocochlear deafness. The first of all, we'll go step by step. First of all, where is the BARA right answer? BARA is the right answer in investigation of choice for neural deafness. Retrocochlear deafness, the first point. Second is a investigation of choice in a newborn. Yes, in a newborn where we are suspecting congenital deafness. Second point. Third point, BARA is the right answer for which MCQ is right answer for screening test. Is a screening test in a newborn who is admitted in ICU suffering from intracranial infection. Intracranial infection. So first of all, step by step, we are making the concepts. Is in BARA is the investigation of choice for neural deafness, for retrocochlear deafness, is the investigation of choice for newborns, for congenital deafness. But if the examiner mentioned the newborn is admitted in ICU, then we will go for is used as screening procedure of choice. Is used as screening procedure of choice for a newborn admitted in ICU. Now we have a mnemonic for the waves, the landmarks ECOLI. These are landmark of the auditory pathway. So this is your 8th nerve. The first landmark is always 8th nerve, then is your cochlear nucleus, then is your olivary nucleus, then is your lateral lemniscus, and one is inferior colliculus. Now the mnemonic is give 2 waves to the first one, give 2 waves to the last one, and rest everybody will have only 1 wave. Wave 1, wave 6 and 7, wave 1 and wave 2 for 8th nerve, wave 6 and wave 7 for inferior colliculus, and rest all have only 1 wave. Okay, so I have asked you the wave 3. So wave 3 will be going in the favor of cochlear nucleus. BARA is an important investigation which they will ask you in All India AIMS examination. Now, sometime examiner asks you which is the largest wave. L for lateral lemniscus, L for largest wave. Just remember this concept. L for lateral, L for largest wave. It is the largest wave. Sometime they can ask you at birth which waves are visible. At birth, wave 1, odd numbers, wave 1, wave 3, wave 5. They are commonly seen. They are observed at birth. Always remember this point. They are observed at birth, wave 1, wave 3 and wave 5. Clear? So these are the basic points which they can ask you in All India examination. BARA is one of the important crucial investigation. The first point, they can ask you to identify the investigation, or they can ask you one-liner, 3 one-liner answer to which is BARA I have discussed. Then a mnemonic, that is your ECOLI, 8th nerve, cochlear nucleus, olivary, lateral lemniscus, inferior colliculus. First landmark 2 waves, last landmark 2 waves, rest everything 1 wave. Clear? So these are the basic points on this MCQ. Let us move to the next one. The second question, I have asked you the resonance frequency. I have given this MCQ even before because this is very crucial point. What do you mean by resonance frequency? Resonance frequency means a frequency at which the structure give minimum resistance to sound. It give minimum resistance. We use a word impedance. What is impedance? Is a resistance. Medical term for resistance. Minimum impedance to sound. So resonance frequency is a frequency at which the structure give minimum resistance to sound. Now, vibrate, just 1 second, is a natural frequency at which the mass will vibrate. Clear? Now, I have asked you what is the resonance frequency of concha. Now, I have given all the important frequencies which you should remember. Natural frequencies, which should be on your tips of all these middle ear, external ear conduction compartment. Conca, always remember, it is 4000 to 6000 hertz. It means that conca give minimum resistance if you provide a sound of 4000 to 6000 hertz. External auditory canal, the resonance frequency are 2000 to 3000. Tympanic membrane is 800 to 600, 1600 hertz. Ossicle, they have 500 to 2000 hertz. If you remember the concept, ossicle have resonance frequency at 2000. Therefore, it is only because of this concept, otosclerosis, we get Carhart notch at 2000 hertz. There is a correlation between these two. And middle ear have a resonance frequency of 800 hertz. So sometime examiner ask you these frequencies. They can ask you the definition of resonance frequency, or they can ask you individual resonance frequencies. Clear? Very simple, straightforward one-liner for your All India examination. Next one, I have asked, this is a rare MCQ, which I have asked you for the first time, and I think in the GTs we have not discussed these points. Sometime examiner asks you unilateral superior laryngeal nerve palsy. Unilateral superior laryngeal nerve palsy. Posterior commissure points to, is a very old rule, that is PPP, triple P. What is this one? Posterior commissure points to paralyzed side. Wherever the paralysis, like right side paralysis is there, the posterior commissure will point to this area. Is very old, important PPP rule, which you should remember. Is a sort of new MCQ. So always remember, in case of unilateral superior laryngeal nerve palsy, posterior commissure always points to paralyzed side in unilateral. Clear? So this is an important one-liner which you should remember. As for supralaryngeal nerve, you should remember supralaryngeal nerve is responsible for protection, is responsible for preventing aspiration. Therefore, we call it as safety nerve. Okay. Sometimes NEET people can ask you which of the following muscle is known as safety muscle. Safety muscle is your posterior cricoarygienoid, PCA. Posterior cricoarygienoid is the only abductor in our larynx. We also call it as safety muscle. We also use the word safety muscle for this one. Clear? Going to the next one liner. In the internal auditory canal, the vertical crest, the bill bar, mark a plane between. This is very conceptual, very nice MCQ, which they have asked you on the facial nerve anatomy. This is my external auditory canal. So internal auditory canal, IAC, I also call it as internal acoustic meatus or internal acoustic canal. So is a meatal segment. If you go in the anatomy of facial nerve, you will appreciate this point. This, once the facial nerve exit from the brainstem, this is my brainstem. The facial nerve up to the brainstem is your intracranial segment. But once it exit from the brainstem, there is a canal which is known as internal acoustic canal, and your facial nerve crosses from this canal. So if I take a section of internal acoustic canal, we get four parts: anterior superior, anterior superior, anterior inferior, posterior superior, and posterior inferior. Now what examiner have asked you, the arrangement of all these nerves in these four quadrants. So always remember, the facial nerve is taking the prime position, anterior superior. Cochlear nerve is taking the position of anterior inferior, while superior vestibular, inferior vestibular, they are arranged in this manner. So this is the basic arrangement of all the four nerves in four quadrants. Now what he have asked you, what is a vertical partition? What is this partition known as? This partition which is there between facial nerve and superior vestibular nerve is known as Bill's bar. The vertical partition between facial and superior vestibular nerve is known as Bill's bar. And this horizontal partition, now examiner asks you about this horizontal partition. This horizontal partition is between facial and cochlear. I always say the name is hidden in itself. FC, facial cochlear. The partition between facial and cochlear, we call it as falciform crest. We use a word falciform crest. What is falciform crest? Falciform crest is a horizontal partition, between facial and cochlear. I wish every student to write all these basic points. The vertical partition is known as Bill's bar. while horizontal partition is known as falciform crest. Is falciform crest. Now, sometime examiner can ask you a very clinical, nice MCQ. They will ask you a tumor is coming in this area. Can you appreciate? One tumor is coming from this area, inferior vestibular nerve. Which tumor I am talking about? I am talking about acoustic neuroma. Just try to appreciate the beauty of anatomy. The acoustic neuroma is arising from inferior vestibular nerve. It hardly affects. It affects the facial nerve in very late stage. Question can be there, why the facial nerve is not affected? Why the facial nerve is not affected in very early stage of acoustic neuroma? No doubt, it should get affected. Why? Because facial nerve is very close to infravestibular nerve, but it is always protected by Bill's bar and falciform crest. Can you appreciate? This facial nerve is well protected by these two bars. So what is the clinical importance? Some students might be thinking, okay, why they are asking this falciform crest or Bill's bar? Why? Because it is doing a protection of the facial nerve. Facial nerve is vertically, posteriorly protected by Bill's bar and horizontally, inferiorly protected by falciform crest. This falciform crest also known as transverse crest. Also the other name is transverse crest. We use a word, just 1 second. We use a word transverse crest for falciform. Clear? So they can either ask you Bill's bar or they can ask you the word transverse crest. Transverse crest is a horizontal, vertical bar is the Bill's bar. Vertical is the Bill's bar. Clear? Coming to the next MCQ. The earliest nerve, yes, I will magnify it, just 1 second. The earliest nerve to be involved in acoustic neuroma. Acoustic neuroma, very important point, is the fifth nerve. Earliest nerve is fifth nerve. Sometime examiner checks your presence of mind. Sometime examiner give you 8th nerve in the choice. Obviously, it's a tumor of 8th nerve, so we'll go with that choice. But in this MCQ, I have not given any 8th nerve, so answer will be your 5th nerve. Acoustic neuroma is commonly which nerve is involved? Inferior vestibular nerve. Always remember this point, inferior vestibular nerve is involved. Investigation of choice, acoustic neuroma. So we always go for BARA if you go with the audiometry. If you go with the radiological investigation of choice, is your gadolinium enhanced MRI. Gadolinium enhanced MRI. On gadolinium enhanced MRI, we see a ice cone appearance. On gadolinium enhanced MRI, we see a ice cone appearance. The treatment of choice of acoustic neuroma is your surgery. These are potential one-liner for all India examination. Sometime examiner asks you which investigation is mandatory. Which classification is mandatory? So we use Antony classification. This is a patho classification, Antony classification. On histopath, we see Antony type A, Antony type B cell, Antony type A, Antony type B cell. Clear? Sometime examiner can ask you a clinical sign, Hestelberger sign. What is Hestelberger sign? Hestelberger sign is your loss of sensation. Loss of sensation in the posterior superior part of the canal. Loss of sensation is in the posterior superior part. We call it as Hestelberger sign. Is because of involvement of Wisberg nerve of Wisberg. Hestelberger sign is because of nerve of Wisberg. Is a branch of fascial supplying the posterior superior part. The next MCQ, little bit difficult but very logical. If you just apply the logical, the language of the MCQ is a little bit difficult. Penetration of which structure allow the infection from the paranasal sinus to the orbit. I'm asking from where the infection is going from PNS into your orbit. It means what is a partition between your ethmoidal sinus and your orbit. Obviously, the answer will be lamina pepraceae. Very simple, straightforward one-liner, but language somewhere. If you see the MCQ, it seems to be difficult, but it's a simple basic anatomy which I am asking from you. That is, what is a partition between ethmoid and orbit is your lamina pepraceae. So I just want to discuss few important landmarks on this anatomy. Let us discuss. This is your cribriform plate. Yes, they can ask you to identify the cribriform plate. The whole roof, if you appreciate, the whole roof of ethmoidal and nose is fovea ethmoidalis. In between a thin plate is there. That is your cribriform plate. If you see, I'm trying to give you maximum MCQs on this slide. This is your maxillary sinus. Very simple. Everybody can identify. This is your inferior meatus, inferior turbinate. This is inferior meatus. Now, if you see above inferior turbinate, I just want to highlight one point. This middle meatus is there, middle turbinate is there. In this middle turbinate, some air is present. What we call it as? We call it as concha billosa. So whenever there is some air in the middle turbinate, we use a word concha billosa. Try to appreciate this one. This is concha billosa. Above this, just above middle turbinate, you can appreciate the uncinate bone. There is a bulge from the ethmoidal sinus. If they highlight this point, try to appreciate bulla ethmoidalis. So as a ENT faculty, what I always highlight, you can see two pneumatized areas. One area is here. One pneumatized area is here. Concha billosa. One pneumatized area is your bulla ethmoidalis. Always make an important concept. Bulla ethmoidalis, the pneumatization, that is blackening, that is air, presence of air. So bulla ethmoidalis is a large ethmoidal cell which is pushing the lateral wall of nose. So the bulla ethmoidalis is always near to lateral wall, while concha billosa will be very near to septum. Am I understandable? Are you getting the concept which I am teaching you? Examiner can ask you to differentiate structure number 1 and structure number 2. This area is concha billosa. This is bulla ethmoidalis. How you will differentiate? Bulla ethmoidalis is always very close to lateral wall of nose. Two pneumatized areas which are visible in the paranasal sinus anatomy. Clear? So lamina paprica is one of the simplest MCQ. I have highlight all these points. Same points I have discussed in the DVT. If you have attended DVT session, we have discussed all these points. Clear? So important points. Yeah, uncinate bone. This is again one of the important points which you should remember. Uncinate bone is a part of ethmoidal bone which is superiorly attached to lacrimal area. Lacrimal crest is attached to the lacrimal crest is a potential MCQ. Uncinate bone superiorly attached to the lacrimal crest. Question number 7. I have given you one of the simplest question on the anatomy of middle ear. That is simplest MCQ. Yes, I have asked you tympanic plexus. What is tympanic plexus? Tympanic plexus is present on promontory. Tympanic plexus is present on promontory. This tympanic plexus is formed by two nerves, 9th nerve and 10th nerve. The fiber of 9th nerve known as Jacobson fibers. Fiber of 10th nerve known as Arnold fibers. Always remember. Arnold fibers are parasympathetic. 10th nerve is parasympathetic. Arnold fiber are sympathetic fibers. They are coming from carotid plexus. Carotid plexus, important point. They are coming from carotid plexus. So I have tried to confuse you between glossopharyngeal, yes, 9th nerve, and glossopharyngeal and parasympathetic fiber or sympathetic fibers. Always remember. Arnold and sympathetic, D option is nothing is the same. Glossopharyngeal and sympathetic, yes, is a true statement. Vagus and sympathetic, no. So answer will be a C option. I have just confused you in the options, but just make an important concept. Arnold fibers are sympathetic fibers. Classical. These type of MCQs are there in All India AIMS examination. Examiner will try his best to confuse you in the choices. Never get confused. Just be conceptual, and these points you will crack only if class notes are on your tips. So please, very humble, very friendly advice, revise your class notes in the last spell. Most common site of squamous cell carcinoma, nasal cavity. Most common malignancy in the nasal cavity is squamous cell carcinoma. If they ask you the invading the skin, we go for basal cell carcinoma. So lateral wall is very crucial MCQ. Lateral wall is the right answer to two MCQs, squamous cell carcinoma and inverted papilloma. Always remember, the benign tumor which is on the lateral wall is inverted papilloma, and squamous cell carcinoma is again on the lateral wall. We can correlate. If we combine both the things, we can get a potential MCQ. Which benign tumor is pre-malignant? Always remember, inverted papilloma is a pre-malignant tumor. Inverted papilloma is a pre-malignant tumor. Inverted papilloma is a pre-malignant tumor. Clear? Now, question number 9. I have shown you a image. If you see, well, first of all, make a spot diagnosis. Which image I have shown you? This is a classical patient of parapharyngeal abscess. So first of all, make a diagnosis. This is parapharyngeal abscess. There is a pus in the parapharyngeal space. Is one of the most common site of abscess in head and neck. Parapharyngeal abscess, we always say, is a area where retropharyngeal Ludwig abscess, everybody drains in this area. So it is one of the most common. This parapharyngeal space have two compartments. In front of styloid, that is pre-styloid compartment. One is behind styloid. We call it as post-styloid compartment. Pre-styloid compartment always have pterygoid muscles, and post-styloid compartment always have carotid artery, jugular vein, and last four cranial nerves, 9, 10, 11, 12. So right answer will be 4 nerves are crossing 9, 10, 11, 12. Nerve 7th, nothing to do with parapharyngeal space. So right answer will be D option. The fourth option will be the right answer. Simple, straightforward MCQ. Now parapharyngeal abscess, just remember one point. I give a incision on the parapharyngeal abscess anterior to sternocleidomastoid. Very crucial point for all India. If you are giving an incision anterior to sternocleidomastoid is parapharyngeal abscess. And if you give an incision behind sternocleidomastoid, it is retropharyngeal abscess. Is retropharyngeal abscess. Clear? The last MCQ I have asked you on a IL examination. A patient of phone asthenia, that is weakness of muscles. Normal, when I perform IL examination, normally whenever I see IL examination, the aryepiglottic fold are elliptical. They are elliptical. But on IL examination, if I see, normally it is like making a oblique, slip of tongue, it's making a oblique view like this one. This is a normal aryepiglottic fold. But now on IL examination, if aryepiglottic fold is making a ellipse, is a hallmark feature of thyroarytenoid weakness. On IL examination, if aryepiglottic fold, this is the appearance of aryepiglottic fold. Aryepiglottic fold is making a triangle. If they are making a small triangle, we call it as interarytenoid paralysis. Interarytenoid paralysis. And if they make a keyhole appearance like this one, keyhole appearance, it means both are paralyzed. Both are paralyzed. Expected MCQ, they can ask you phone asthenia, what is management of choice? Management of choice is wait and watch. Is weakness of muscle fiber. So we always go for conservative management. Wait and watch. Wait and watch is the treatment for the patient. Wait and watch is the treatment for the patient. Clear? So we never operate. I have given all these three findings to you in the explanation. Now, very crucial point, after CBT, we are having last 1 month for your All India examination, 25 days left, and if you use these 25 days in a nice way, you will be getting a good rank. Class notes should be on your top priority. Just revise class notes with minimum 150 to 200 MCQs every day. These MCQs should be done with time-bound game. What is time-bound game? You should do with stopwatch. If you're doing 150 MCQs, they should be done within 75 minutes. Last 1 week, last 5 to 6 days, always go on short subjects. I am just giving you few tricks to improve your rank. Short subjects should be given preference in the last few days. Clear? We all had worked very hard for this main examination, All India PG examination. I want you people should get very good rank in all upcoming examination. Short subjects in the last few days. Never panic in the examination hall. Relax mind. Go and just remember, you are Damsonian. You will definitely get a good rank in All India PG examination. Very best of luck. Any MCQ you can ask me on the exclusive club. Any update you want, I will add all those points. Any point you want to be discussed, you can just tag me #Dr. Deepak Arora, or you can ask me on my WhatsApp number 7837536346. Thanks a lot for your patience. Very best of luck again. Clear?